Deciding the way to change the way that you approach your disease is necessary to heal from complex chronic illnesses. I'm going to share with you how a health coach can help you in making the changes to deal with your chronic pain and even other symptoms for that matter, what is at play here, and why you need to make some changes in your life and how you can get help doing that, right? That's the more difficult part actually. So I'm opening my coaching program for women with autoimmune conditions. It's called Healing from Within. It's going to open for enrollment just for a few days next week on 28th of March till and it will close on 31st of March. I work with a limited number of women, and who want to ease their pain, ease their, improve their energy levels using a root cause functional medicine approach. So you can schedule a free 45 minutes clarity call using the link that I have posted in the post below, in the Facebook post, and in the bio for the Instagram post. If you're watching it on replay, make sure that you check out the link. So today it's about the changes that are often necessary, and many of you, I mean, you might be already aware of that. Things in your lifestyle, in your diet, and in your environment might be contributing to your pain, your fatigue, and various other symptoms that you might be dealing with. So, for example, if you are dealing with chronic pain, pain is a very common symptom in the case of severe illnesses like autoimmune conditions. So, if you're dealing with that, then going off gluten and dairy are very important necessary steps. Doesn't have to be, of course, from day one, but it has to be done eventually, and it's hard to do that. In fact, one question that I often get asked is, is it necessary? How do I do that? I know that I need to make some dietary changes, but it's so hard. I you know and I'm not sure I can actually sustain that, and I get that. It's something that we is not easy, but it's certainly possible if you have the right kind of support and the guidance, right? So because a lot of the inflammatory so a lot of the inflammation that is lies underneath chronic pain is what you need to actually address. This is the root cause approach that I was talking about, and foods like gluten and dairy contribute to that. Of course, there are other things like maybe some medications you're taking, toxins that you're exposed to on an everyday basis in your immediate environment, in the air, in the food, and even in the personal care products that you might be using. So all of these have to be addressed as well, which are right now contributing to the inflammation, which is contributing to chronic pain. And so these changes in your lifestyle, in your diet, is what you need to actually approach rather than trying to medicate only. Of course, medications have their role here. They can help in managing some of the more severe symptoms while you're trying to figure out what's really going on. Again, it's not either or, but it does help if you are able to and simultaneously start working on some of these underlying causes which are contributing to your chronic pain or even the other symptoms. But again, change is hard, so you need that support and the guidance that are and because we are talking about, a lot of it will be has to become a way of life. It's not a kind of a thing that you do for a few weeks, maybe 1 or 2 months, and then you sort of go back to your old lifestyle. That does not work, because all those factors over years and usually decades have led you to this point. So just by doing it for 1 or 2 weeks is not going to be really fruitful for you. If you want to see real health improvements, like sustainable health improvements. And when I work with women in my coaching program, that's my objective, to equip them with tools and with resources which will help them to see sustainable results, sustainable health improvements, not just a one-time thing that the minute that they stop working with me, they don't sort of they slip back to their old habits and their old routines. So behavior change forms a big part of my coaching program, and this is where a health coach actually plays a very critical role, because even while knowing what you need to do, it's hard to make the changes. Life gets in the way. We have family responsibilities. If you want to make some changes in your food, the rest of your family is eating something else, you are trying to eat something else, you might be traveling. That becomes actually a big thing. And I keep hearing this, if I make these changes, when I'm traveling, what do I do? So we co-create a plan. Actually, we talk it out. We figure out restaurants, we figure out alternatives, we figure out things that you can take with you along the way. And I talk from a professional and personal experience of doing this, because I changed my family's lifestyle and diet several years ago, 2014 to be exact, when my daughter had a severe health crisis, and I realized that she needed to be off gluten and dairy to a large extent. She still is. And gluten certainly does not suit her. And I realized it would help the rest of the family also. So by and large, we are gluten and dairy free in our house. It's only when we travel that, or we eat out, we make some exceptions. But the point I'm making is that, it's over the last 8 years or so that I have learned what are the tips and the tricks and the hacks that you can sort of, use to make sure that you can continue to sustain those kind of changes, make it as simple and effortless for you to make these changes in the first place, right? So it doesn't have to be from day one, of course, but eventually, slowly we put systems in place, we put processes in place, we make it as easy as possible by having a meal plan, by having a list of groceries and other things that can help you to make these changes, because it's about focusing on what you can control. Like, there are many things that you can't control. For example, you might have a whole host of unexplained symptoms. You may know that you have some kind of an autoimmune condition, for example. You have some level of antibodies, but you're not sure whether you actually have anything or which one you have. And again, a lot of times, since it's so hard to get a diagnosis in many of the chronic illnesses, and it takes time to get a diagnosis, in the meantime you're like actually stuck with all these symptoms and you don't know what to do with it. You can start focusing on what you can actually control. So by which is your the food that you put in your mouth, which are the products that you put on your body, which are the lifestyle, which means that, the time that you go to bed, the time that you wake up, the exercise that you do or you don't do, stress management techniques, all of these are in your control. And you can actually create a plan to start working on these factors, because these are powerful changes that will completely transform your health. In many cases, many of the symptoms go away simply by addressing these lifestyle factors, because they actually address the underlying imbalances and deficiencies which have led you to this point, right? So functional medicine understands this really well. It's uh, it's actually the medicine for the 21st century, especially when it comes to dealing with chronic care. Acute care is very well taken care of by the conventional medicine approach. It's when you come to chronic health care that sort of that falls through the slips through the cracks, because functional medicine understands the origins, prevention, and treatment of complex chronic health issues. So if you are dealing with an autoimmune condition, for example, we keep going, further and further upstream to understand what really led you to this point, what was really going on in your childhood, in your youth, in now, what's led you to here, what are the triggers, what are the root causes, what are the underlying imbalances. So we sort of put all of this together and figure out the interconnectedness between the symptoms that you're facing with between the health issues, and all of that, and the way you are thinking, the way you are eating, how you are eating, everything has to be taken into account, because they are all connected. And using a mind body approach, we customize a whole healthcare plan. And that's how we approach any kind of chronic illnesses. And this is where a health coach can really help you. So Mrs Patel, who had come to me, she was a retired doctor. She came to me several years ago. She was on hypertension medications, antihypertensives for her, couple of them actually, for her high blood pressure. She was on a statin drug. She was on a couple of other medications, and she managed to actually go off I think one of her hypertensives, she managed to go off a couple of her other drugs by making some lifestyle changes. She was already actually eating quite healthy, but there were certain foods which actually were not suiting her. She did not know how to make those changes, how to stay off them. So by working with me and we just worked for actually about 3 months. She didn't have major severe major health issues or severe health issues, but it was she had asthma, she had skin conditions, which is why actually she came to me. But then we figured out that there were other things that were going on, and once we addressed that, her skin conditions went away. Her She was on antihistamines every single day. She was able to stop her antihistamines actually completely, right? And that gave her a big relief because she had been taking them since her childhood. So these are the things that, because once you are focused on what you can control, once you're able to make those changes in your lifestyle, in your diet, and as I mentioned, that a health coach can actually help you do that, right? You have the tools and the resources at your disposal, and to make and then sustain them. And even when I was actually got in touch with her this year, just to see how she was doing, she was still off the foods a majority of the time because she realized that's what actually suited her body. She was able to actually sustain many of the changes that we had worked towards, simply because she had all the resources that she needed now. And what are these resources? These are things that support behavior change, because here we are actually talking about behavior change. It's not enough to just know what you need to do. It's not enough to just have the information, as I like to say, is free on Google. You don't need to come to me for information on how to manage your disease. What you come to me is for my expertise, for the process that I follow, the framework that I follow within my coaching program, Healing from Within. It's a three-part framework, and that's what helps you to make the changes, change your behavior, change the mindset, the approach that you have towards your disease. And that's what creates long-term health, because you want to create long-term sustainable health, not something that sort of just goes and comes. And it has to be co-created. It has to be customized for your unique body's requirements. So there are tools that I use, like motivational interviewing, which helps you to draw out your own reasons for change, because you need to actually become aware of what are your reasons for changing, not what I think they should be, or anybody else for that matter. So discovering your own power to change is a really powerful tool. It's transformative. Then, of course, positive psychology, which means that we don't only talk about the things, all the things that are going wrong or possibly can go wrong. That's not really a big driver to make changes, because it's out of fear that we make changes, and that's not really sustainable. So positive psychology helps you to actually focus on all the good things in your life, things that you're grateful for, things that are going well, and that gives you the motivation to keep going, to moving forward, to sustain behavioral change. And of course, character strengths. Each of us have 24 character strengths. I help you to uncover what they are. And as you appreciate your own strengths, they are the core of who you are. And you actually start utilizing them with more intention. You might already be using your strengths of creativity, bravery, honesty, fairness, right? But there are when you are aware of what these strengths are, you can actually be much more proactive, much more intentional in learning how to use them to make changes, to sustain changes, to take care of your health, to make your self-care a priority. Self-care is often missing in many women, and they're not even aware of that. They're not aware of the importance of that. So if you have been struggling with that, all of these tools that I just mentioned will help you to have what you need to make sure that your health is a priority without guilt, so that you can start taking care of yourself on a long term basis, right? So that you can create long term health today, tomorrow, and for the rest of your life. And it's about co creating a personalized plan that works for you. It's not about what your doctors think. It's not about what I think. It's not about what anyone else thinks. You know yourself, you know your body, and once you start tuning into your body's wisdom, this actually forms a big part of my coaching program, where we start treating our body as a friend rather than being constantly at war with our bodies, disliking it for all the symptoms that we are dealing with. Maybe it's weight related issues, right? We are conditioned to not really like our physical bodies and our appearance much. And this program, I mean, and this is a big part of what holds us back from healing from within, and that's why it forms such a big part of my coaching program. And with all the coaching tools that I just shared with you, it becomes really effortless in many ways. And that's exactly the terms that my clients use, effortless. When you go through this entire 6 month program, you know how it can really transform your life. So if you are a woman, you know, with autoimmune conditions, you're looking to ease your pain and your, you know, increase your energy levels, reduce your suffering, using a root cause functional medicine approach, then make sure that you schedule a free 45 minutes clarity call. This will help us to see fit a right fit for each other, connect, get to know each other a bit better, and you know, see if, what are the next best steps for you, so you can take the best decision for yourself going forward. The coaching program Healing from Within opens for enrollment for a few days next week, from the 28th of March to the 31st of March. So make sure that you head over to the link in the post. If you're watching this on Facebook, this link is in the bio for Instagram. And if you have any questions, if you're watching this on replay, make sure that you drop in the comments. I'll be sure to answer that.